Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Anna Turman. She's System VP of Region Health at CommonSpirit Health. Welcome, Anna.
Thanks, John, for having me. Truly blessed to be here. And I love that comment on our jobs are challenging.
It's true. And I think it's gotten more challenging. Now, on these CIO podcasts, like I haven't heard anyone say, you know what, the CIO job is easier now than it was 10 years
It's a
ago.
cakewalk. It's a cakewalk.
Yeah, it does. Well, and I'm excited to have this conversation because a lot of times in the CIO, when we talk a lot about technology, but I think in this one, we're going to talk a lot more about leadership. So, but before we go there, tell us a little bit about yourself and CommonSpirit Health.
Yeah, I am the Assistant Vice President of Regional Health Technology. I have a very diverse background, very unique, diverse background. I've been a CIO, a COO, and a CEO in healthcare, and I have 25 years of experience there.
Wow. Yeah, I think this is the first time we've had someone with that kind of background. That's awesome. So talk to us. I mean, since you've had that background, what do you think is the most important thing, a thing a leader should be doing in this current environment, which is kind of uncertain, I think is how I would describe our current environment.
That is a really good question. And if I was to think about that, I think for me, connection is one of the most important pieces because again, as a leader, what should be in the forefront of our mind all the time is people. And so like the art of rounding for me is the most important. Going around, rounding. It's good for the heart. I mean, you're walking around, right? It's good for the soul. It's good for the mind. I'm very deliberate when I round, and I think we all should be very deliberate. A mentor once told me, don't start your day with your emails. You'll get caught up in task-oriented stuff. Start out getting out and seeing the people. So rounding is really important. And I actually have this whole method to it. It's if you want to remember it, claps, right? You're doing rounding to connect. You're doing it to level set the why. Why are we here? What are we doing? Are we taking care of the patients? Are we here for the patients, right? And then adding value, and then being proactive. You know, what's the problems going on while I'm here, standing here, working with you, whether it's in a huddle and you hear the safety issues, right? And then finally staying relevant. You're not going to be relevant as a CIO if you're not rounding your sites, rounding those hospitals, checking in with them, seeking to understand, like deeply seeking to understand what their needs is, what their challenges are, what their barriers are. So I think that's one of the most important things as a leader in healthcare and in technology is rounding, seeing the whites of the eyes, being in that front line, being in their shoes. Speaking of being in their shoes, be sure to wear good shoes for that rounding. No heels, ladies, no heels.
I think what's interesting about what you said is everything you said was about them, not about you. And I think, it's interesting as leaders, sometimes we're like, oh, I need to go talk to this person about this thing, or I need to go push this initiative. And everything you just said in your rounding was, I need to hear them and what they're saying and what they're doing. So that's fascinating.
Yeah. There's an old adage. How does it go? It says, no one sees what you see, even if they see it too. Right? So if you were deeply thinking about that, it's important to understand is even if you're communicating, initiatives, that's an opportunity to communicate initiatives while you're rounding. Hey, this is coming up and this will solve and improve your experience, et cetera, right? Start drawing that line to connect them to initiatives that IT is doing. But more importantly, understanding what their needs are and listening first. And so this way you can both see what each other are looking at, and honestly, if you seek to round and listen deeply, then you're also going to get that mutual understanding. It will follow, right?
Yeah.
So no one sees what you see unless, or no one sees what you see, even if they see it too, means that you're going to have to get to a mutual understanding or a mutual goal. And to do that, you have to kind of seek to understand where they're sitting, where they're standing, what initiatives, what are the barriers. So
Yeah, that's great advice. So, when we were prepping for this, you talked about something really interesting, and that's how a CIO should use, their why with story, to be able to communicate with your team, and also using, both IT business language and human language in that. Talk to us about that and how you kind of use this and how you approach, talking about your why and using stories to communicate with your team.
it's funny because I think most CIOs and most people in IT, most leaders in IT will sit down and say, more specifically, they'll sit down and say, hey, we're here because we're business partners. We're not just IT, right? We're not just here because we have vernacular in IT. We're
Mhm.
here as business partners. We're coming to the table as business partners. And we say that a lot. And if I was to think about it, it's not just that we're business partners, because if we're talking about telling the story, you have to connect them even deeper than IT or business, right? You have to have that IT vernacular. You have to understand how you can support or help or improve their needs or problems. But and you have to be able to speak the business language, what's important to them, how it connects, right? But more importantly, you have to connect to their why, connect to them. And it's hard if we're just using data or if we're just
Mhm.
using business vernacular, right? Either one. What we have to do is kind of get down to that again, mutual understanding, right? So if we seek to understand and we tell it through a story, something that impacts them. As humans, stories are more impactful. When did you once see this happen, and connect them more deeply? Because you can use data, you can use slides, but until you use a story to tell the tale, to connect them more deeply, it's just a business and an IT transaction that you're working, or initiative that you're working to sell them or mutually get them to understand. And it's so much easier to do that when you are telling a full story that's very connective to the human soul, like connecting to the person themselves.
Yeah, and you just highlighted an interesting difference. I kind of talked about the why of the organization or the why of the project, but you said what's their why, which I think that's something we lose too. Like, well, you should just assume they love patients, or maybe some of them actually love data, right? Like, data is what drives some people, right? Because they want proof of whatever it is. But that's interesting to dive into their why, but I think that's a challenge as a leader to do that at scale, right? Like,
Yeah.
because lots of people have lots of different whys. Any ideas and advice on how to handle kind of disparate whys in your organization, and how to understand what is their why?
Well, if you're rounding enough and you're sitting with 10 different people at a table and you've rounded those folks and been to their huddles or worked with them, then you better understand. But sitting in the room, CIOs have to also have a really keen eye and to be situationally aware, because if they're not understanding that, we talk about it all the time. Something might be bothering someone specifically. It could be something at home. It could be something at
Sure.
work. So how they're feeling that day, you have to be very aware that someone's a little more closed off sitting at that table and they're not going to connect as well. So you make sure that you see that and aware of that and try to address it as you're speaking. Maybe give them more eye contact or maybe walk towards them. Just being more situational aware. That's a skill that is part of influence. People speak that we have to have influence. We have to have a good skill set and influence. But I think it's situationally aware is kind of that foundational piece to influence, is to understand the room itself, who you're talking to, and what's deeply affecting them. It could very easily be, well, that clinic goes down for the morning, or it could very easily be, I got my kid to school late, right? And so they're just stressed out. So bringing that calm and realizing that there's something bothering them, you have to kind of adjust to each and every one of them, all 10 of them, if there's 10 in the room, right?
Mhm.
Which is challenging. Do I have an answer to that? No, I don't.
Takes work, huh? But it is something you can develop, which is interesting. But I actually think this problem is going to become even more challenging because talk to us about how you think a CIO can lead effectively with remote teams, which I think is going to become even more common as health systems continue to expand and buy and acquire. CommonSpirit's a large organization already, right? How do you lead effectively with remote teams? Which obviously there's a whole discussion: should we go back to the office or not? But as they expand, you by nature have to have some remote teams to support large organizations. So how can we do that effectively remotely?
I think each of us are a little bit unique. Like if you were to ask, 100 people, would they prefer remote or not remote? There's going to be folks that have the personality that do remote very well, who can be disconnected and still be connected in a different way, and enjoy that. And then there's other people like myself who my energy is powered by two things, sun and people. And so I find more and more energy when I'm around people. So those types of people, it may not be as conducive to their productivity if they are remote. And so you have to seek to understand your own people. You have to round your own people, right? And seek to understand them. But at the end of the day, no matter what, even if they are the type that like to be more remote and they prefer that, they're human, and we still need that connection. I was recently went on a trip, and actually it was a long trip. It's a rounding trip, right? There was 1,600 miles, 26 hours road trip, like 26 hours windshield time,
Wow.
and 4 gallons of windshield wiper fluid, right? I was decimating the population of bugs in that state to around 10 hospitals. So those folks are not remote. They are on site, but they're remote to me and when I was leading them, right? And so rounding and going to round with them, it was so amazing to see that there's so much more connection when you're there physically, when you're there communicating, shaking hands. In fact, someone I never met in person, hugging, right? When they come up to you and they hug because they're just so grateful to be communicating with you in person. So I think as we go more remote, we need to make sure we're still doing that in-person connection somewhere, because Zoom or whatever else platforms, they cannot solve that human desire to be more connected, shake a hand, laugh together over something, bring humor. It builds resilience. If we keep them too remote too long and they don't have that connection, then you might be losing a little bit of resilience, a little bit of retention. There might be some things that are lost there. So there's probably has to be a balance based on the fact that there's so many diverse people and what their needs are.
Yeah. So that company-wide email doesn't create connection the same. Just kidding.
No, well, unless you're telling the story. Now, if you're telling the story and you're saying, hey, this is why we're doing this, and tell a beautiful story about, a mother and child in the hospital, maybe it does connect them.
Yeah, that's fair. Although it's interesting. I mean, we've seen it on Healthcare IT Today, the power of video, even, right? So even if you're
Right.
remote, telling that same story through a video can add some depth of connection that even a well-written email is tough to do. So it's interesting how much we desire that human to human connection, I think.
There is a challenge in it. Like, I agree. You can see when they're crying, you can see when they're upset. But I have noticed that when you're, like we were talking, when we're sitting in a room of 10 people versus if you have a Zoom of 10 people,
Mhm.
the ability of me to use my skill set to assess a situation, assess the room, to understand where people are and be able to influence appropriate is a little more challenging. It does add challenge because you cannot see all their mannerisms. You can't tell, if something is bothering them, because it's more of you have a better ability of a mask, especially if they turn the video off. So
Yeah, that's fair. So you talk about an IT team of excellence. TOE is, I think your definition or your abbreviation for it. Talk to us about what you see as an IT team of excellence, and how do you use that to lead effectively?
So it's a framework for me, and it's basically saying there's good IT teams, there's great IT teams, but to be a team of excellence, you have to go from this to this, right? Go from good to great to team of excellence, or from great, or just from good to team of excellence. But it's based on different aspects that are really important for a team, right? One of them is competence and coaching, right? So coaching, you're a good team if others are investing in you. You know, where other if others are investing in me, I'm part of a good team, right?
Mm.
But if I start investing in myself, then I'm probably part of a great team. So I'm being invested in and I'm investing in myself. I'm part of a great team. But a team of excellence is when that team is not only just being investing in themselves, but they're investing in others, right? So we're starting to lift others. Um, one of the one of the parts of that framework is to connect. And again, it's like you bring value to the team. A great team would be that you synergize the value of the team brings. And there's synergies there. You see how everybody is interacting. And then the team of excellence would say, I belong and have value beyond that team, right?
Mm.
So connection is really important, and competence, this is just an example, and connection and competence are really important in coaching, because it allows you to, if you're at that team of excellence, you're able to reflect on, what's going on. You're able to reference and say, this is going well, right? You're able to recall a time you've done it and use that as a story, right? And then that team is recognizing each other for it. So it's like a 4R connection, right? So it's just going above and beyond. I think the best example is saying, if I was to simplify it, we're a good team if we're delivering IT. We're a great team if we're delivering, above and beyond our goals. We're exceeding our expectations, right? We're not just meeting, but we're exceeding. But a team of excellence is when you're lifting up the hospital president to achieve their goals, right? When you're lifting other teams to achieve their goals. So being aware when you're rounding what their goals are and helping them, because that's what we do. We enable the business to succeed, right?
Yeah.
And so that's why we want to be business partners. We're not IT. We're here for you, to support you to be successful. And you can't do that unless you're a team of excellence and you actually understand what their goals are and what they're trying to achieve. And then you're helping them get there.
Yeah. It's interesting. I almost would describe you're saying let's actually be good business partners rather than just say we want to be your business partners. That's how I would define this discussion right here.
Yeah, yeah, absolutely. Absolutely.
Interesting. Well, kind of to some of what you just said, talk to us about the importance of mentoring and mentorship. It sounds like you may do it within your organization, but I imagine you've had experiences, outside of the organization in your career and with other people. And particularly talk about this, the value of mentorship and mentoring when it comes to, state the obvious, you're a woman CIO and there aren't enough of those. We know because we try to incorporate as many as we can, and the numbers are against us. But talk to us about mentoring and mentorship.
Yeah. So it's interesting, if you don't mind me kind of maybe going down a strange path to answer this one.
Yeah.
But I never really had female mentors. If you were talking about more formal approach,
Mhm.
right? I didn't have any female bosses for many, 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 many years. In fact, I had my first one as of recent, right? So to think about that, I didn't even realize it. You don't think about that until someone points it out, right? But as I was growing with mentorship, for me, I realized that I need a little piece from everybody. I need a little information from everybody, because this mentor may not be great at this, A, B, and C, but he's amazing at X, Y, and Z, right? And so I want to mentor off the X, Y, and Z, right? And based on that, I kind of built what I call my own personal advisory council,
Nice.
and it's very diverse. And there's always and then I can specifically name them, but I won't do that. um, but that I have them in positions where they're either outside the industry, they are in different industries, so to speak. I have people that are either CEOs or CIOs or COOs or as long as they're a leader, I want it diverse. I don't want all CIOs or all CEOs. I don't want all female or all male. I don't want, I try to make it as diverse as possible, even going outside the industry. I have one that is a lieutenant colonel, right? And so in the military, so not just private, but private and public, right?
Mhm.
So really getting that diversity. And so when I have something I want to soundboard or I want to think about or I want to be mentored in or coached in, I look at my own advisory board and think, okay, this person is great at this. I keep this person because he can help me level set and, seek to understand and help me reference and write a story to it to say, this is how I do it. This is how I think you should do it. And we can have that soundboard, right? It's just a much more diverse soundboard. So mentoring, I think, has been just so spread out and diverse. I wouldn't say that any specific mentor was important in my life because early on, I decided I needed my own advisory council so that I could hit certain areas where they were amazing.
That's really interesting. And I think the other challenge that I see, it's interesting that you didn't have a female mentor for a long time. And, I look at it and I look at many of the female CIOs out there that could be mentors and would be great mentors. And I look at it like there's so few of them. Where do they have time to mentor and to speak at every event so that there's a diverse panel of speakers and to do, et cetera, right? It's
Yeah.
almost taxing to someone like you that, so anyway, it's an interesting balance to, you're pretty blessed to have someone that can do that. I think that's awesome.
Yeah, it actually helps also to the fact that there's a lot of commitment to a mentor. If I'm mentoring something, I'm committed to that someone, right? And it takes quite a bit of commitment and time to mentor and vice versa. So to just put that commitment on one person is hard. That's hard
Mm,
on them, right? To expect that they have the answers to all things. And then they feel like they have to have the answers to all things so they can mentor you appropriately. And I think that that's why I spread it to an advisory councils because we're all very busy. And so I lean on and lean in where I know that they're really amazing. Like out of them, there's one I go to when I want to be challenged. Someone's going to challenge me. And there's someone there who's gonna, really great at influence and speaking and communicating, and so you just kind of go in that direction. So yeah, it's taxing on people,
yeah.
but we have to do it. I mean, if we don't invest in others, again, you're not part of a team of excellence, right?
Yeah, that's great. Well, and I mean, to your point, if they're not busy, do you want them as a mentor?
Right.
It's an
I
interesting
agree.
question. I mean, maybe some
Yeah.
retired people, I guess, could fit that, but but even then, most retired people that you'd want as mentors still have other stuff to do. So it's interesting.
Yeah.
Well, we always like to end these podcasts with a little bit of career advice. So, what would you say is maybe the best piece of advice that you've been given in your career?
Well, I mean, after everything I said, I'm going to have to end it with the unique piece, right? So be uniquely you, be yourself, take a little part of something that you think is amazing from every leader that's been in your life or every mentor. It doesn't even have to be a leader that's been in your life to create that leadership style. It's like a chef. They take recipes, right? They probably have their mom's spaghetti recipe, and a great chef will take that recipe and add his own flair to it, and then it becomes his recipe. And everybody goes to that restaurant because that's an amazing recipe, right? Um, but it always has that underlying like historical came from mom, right? Um, but if you want to create your own flair and be an incredible leader, it has to be your recipe, a dash of resilience, a pinch of listening skills, right? So whatever those little pieces and parts are, a cup of rounding, right? Take all those pieces and make your own recipe to be an amazing leader because we shouldn't be replicating leadership of one person. We should be able to add your own flair in there and create your own recipe and to serve those that you are leading.
Interesting. I would say that's one of the takeaways I have from doing the CIO podcast is how diverse each CIO is. and some are dynamic leaders that are incredible storytellers that can inspire, and others are more, practical, boots on the ground. You can trust me. I understand the data and understand the problem. I build trust that way. And so, to your point, each person has to, I like it though. Still the best things from each person that you can find and make it your own. I like that.
Well, the best part is you're not stealing it. You're just, kind of borrowing it, keeping it close, because all these beautiful souls that make up where you are today, none of that's stolen from them. If they're truly a leader, they would have want to share it freely and give it to you. So
it's true. It's not stealing, it's sharing. I love that.
Sharing, yeah.
Anna, well, this was a lot of fun, and I loved learning from you about leadership, and I think a lot of CIOs will really appreciate what you shared. So thanks so much for taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Anna.
Thanks, John.